friends, we're here at the I12 project for Afghani refugees. My name is Cristal reporting for the Hashoo Foundation USA.
I'm Dr. Shahmanu, medical officer for the health project of this camp. We have two parts of the health.
And Sultan is with the Hashoo Foundation, and Kamal is with the Hashoo Foundation also.
I'm from Hashoo Foundation also. Work for UNODC project.
Wonderful.
Zabullah Khan is a psychologist from Hashoo Foundation and work for UNODC project.
Saira Nasir, outreach worker, UNODC project.
Meena, community mobilizer.
I'm Siddiqa, program officer, Hashoo Foundation.
So you want to tell us a little bit about this project and what are we going to be encountering during our visit?
Yeah, a lot of activities are being going on in I12, and we have a project of funded by GTZ, in which we are providing services of education, health services, and skills development for males and females community of Afghan refugees. Here around 3,000 Afghan refugees are residing since last year, and we have another project funded by UNODC in which we'll be identifying people who are using drugs and who are affected by HIV/AIDS, and we'll be trying to cure them, and we'll be referring to them the hospitals.
We used to have a foundation board here. She's Sister Zahra. She's nurse, very good, well qualified and efficient nurse, and another nurse is also here working with me. She is on leave right now.
Wonderful.
So I have two female nurses along with myself to look after the female OPD.
Okay, and so this is a temporary building and the new building is being built?
Yes, it is preparing at the back of this building. It will be ready, hope, within 10-15 days.
Wonderful.
So then we will be, facilitated with more care.
Have the video.
So this is the male office.
He's attending a patient.
He's attending a patient at this moment, a father with his son. Who is our medical technician?
Arif, who is dealing with the patient.
Okay, wonderful. And of course, this is a Hashoo Foundation sponsored project with several other organizations.
The drug users, basically the drug users, they are coming here. Most of the drug users, they are using hashish as a drug, and heroin. There are also 10 cases of heroin. And there are 2 cases that we are just the treatment is in progress, home-based, and they are getting well. And we are also assigned with the anti-narcotics hospital. So when the drug users, when they are willing, yes, we are willing to get rid from this from these drugs, then we send them to the anti-narcotics hospital for their further treatment. And here we want to make them willing. If they are willing, then the treatment will be easy to go for the treatment to the narcotics hospital, or the doctor, our medical doctor Sanaullah, he and I will decide whether the treatment should be home-based or referred to the hospital. So this is the process we doing with drug users.
Another issue, unfortunately, is issue of too much number of patients suffering hepatitis C and hepatitis B. As it is unfortunately a deadly disease, highly contagious, and a very difficult course of treatment, and expensive in fact. So still there has been no helping hand for these people, and no project has come especially to help the people who are suffering hepatitis. And the very unfortunate is, if one person is becoming hepatitis C positive or hepatitis B positive, after 6, 7 or a year, a large number of that family, they are getting this disease. And this disease is coming up, as you see, in the whole colony. So it can be a potential risk already for these people, and where these people approach the hospitals.
And what percentage of the 3,000 people that are in this camp are infected with hepatitis B and C?
I can't say exactly what percentage, because I have never worked on the percentage today, but I can share with you 4 or 5 months of my experience working in the medical outdoor. We had more than 70 female patients suffering HCV and hepatitis B.
And do you know the number of male patients? I assume it might be even larger.
The number of male patients is more, and they are registered with both the Dr. Sanaullah, who is working for the UNODC for drug projects. They have registered more than 150 patients, I think, mostly are males, and also the same amount, almost about 70-80 patients are registered with the male OPD. So these are the cases which come as a result of some other ailment, and once they come with the reports from some good labs, then we come to know that they are the positive cases. There are many cases which are unscreened, and they themselves, they don't know they are suffering the disease.
And what about children? Do you know of any children, any cases of children?
Yes. We have some young children, 5-6 years, few children, in fact, I have come across at the age of 5 to 7 years, and some other few children between 12 and 14 years, which unfortunately, again, they are suffering. And when I went through the exact history, we came to know that most of the members of that family, they are suffering hepatitis C or hepatitis B.
Doctor.